Before we begin, this video is general health education, not personal medical advice. This video is purely educational. It's not medical advice. We'll explore how your skin senses touch, temperature, and pain using tiny nerve cells called receptors. As you age, these receptors can change, affecting how you feel textures or temperature. While this won't diagnose or cure anything, understanding it may help you care for your skin better. Let's dive in. Your skin is a sensory powerhouse with specialized receptors. Meissner's corpuscles detect light. Fluttering touches like gentle strokes, while free nerve endings sense extreme heat or pain. As we age, these receptors may dull, making textures feel different, or temperature shifts less noticeable. This isn't a medical concern, but explains why your skin sensations evolve over time. Your skin is a complex organ with multiple layers and specialized nerve cells called receptors. The outermost layer, the epidermis, acts as a protective barrier. Beneath it lies the dermis, which houses blood vessels, hair follicles, and sensory receptors like Meissner's corpuscles that detect light touch, while free nerve endings sense pain or extreme heat. These receptors communicate with your brain to interpret textures, temperature, and potential harm. This system operates efficiently under normal conditions, but may change with age, affecting sensitivity without indicating a medical issue. Your skin's sensitivity shifts with sun exposure and pollution, weakening its protective layers. Aging alters nerve receptors, while hormonal changes like puberty or menopause can temporarily affect sensation. Though normal, extreme or lasting changes should be checked by a doctor. Lifestyle choices, like sunscreen and hydration, support skin health but can't reverse aging or prevent all sensitivity loss. To protect your skin's sensitivity as you age, prioritize sun protection and hydration. Broad-spectrum sunscreen shields nerve receptors from UV damage, which can accelerate aging and reduce sensation. American Academy of Dermatology. Staying hydrated supports skin elasticity and barrier function, preserving receptor health. Mayo Clinic. Gentle skincare routines with mild cleansers and moisturizers avoid irritation while maintaining sensitivity. These habits support your skin's ability to sense the world, but won't reverse aging or prevent all sensitivity loss. Aging doesn't always mean your skin loses sensitivity. While UV damage or dryness can dull touch, over time, genetics and nerve health play bigger roles. Sunscreen protects your skin barrier, but won't reverse. Aging, it's more about prevention than reversal. There's no one-size-fits-all rule. What works for someone else might not work for you. If your skin's sensitivity changes suddenly, like losing feeling in patches, experiencing unusual pain, or developing itchy rashes that don't go away, it's time to see a dermatologist. These symptoms could signal underlying conditions like nerve damage, neuropathy, autoimmune issues, or infections. A dermatologist can rule out serious causes and guide you on safe over-the-counter options for relief, as approved by the FDA for common concerns like itching or pain. Always follow label instructions carefully and ask a pharmacist if you're unsure about usage. If your skin feels different, like it's more sensitive or less responsive, you might reach for over-the-counter OTC products like moisturizers, creams with menthol or camphor, or pain relievers. These are FDA approved for common issues like itching, irritation, or mild discomfort. Always check the label for active ingredients and follow the instructions carefully. If you're unsure about a product's safety or usage, ask a pharmacist. They can help you choose options that fit your needs without making promises they can't keep. Your skin sensitivity can shift based on what you eat, how much stress you feel, and even your environment. For example, Sugar Glider's nocturnal animal show changes in activity linked to light cycles, suggesting that environmental factors like exposure to sunlight or artificial light might subtly affect human skin sensitivity too. Stress also plays a role. Chronic stress can make your skin more reactive, leading to conditions like itchiness or irritation. While diet isn't a cure, eating balanced meals with healthy fats and antioxidants may support skin health over time. Always consult a dermatologist if symptoms persist, as they can help rule out underlying issues. As you age, your skin undergoes structural changes that affect its ability to sense the world. The epidermis, the outermost layer, becomes thinner, reducing protection and sensitivity. Nerve endings in the dermis also slow down, making you less responsive to touch, temperature, or pain over time. These changes are normal but can be supported by healthy habits like balanced nutrition and stress management. Always consult a dermatologist if symptoms persist, as they can help rule out underlying issues. Diet can influence skin health, but it's not a universal fix for sensitivity changes. Eating balanced meals with healthy fats and antioxidants may support your skin over time by reducing inflammation and protecting nerve function. However, evidence is mixed. Some studies show benefits, while others find no strong link to touch or pain sensitivity. Chronic stress and environmental factors like sunlight also play bigger roles. Always consult a dermatologist if you notice persistent changes, as they can help rule out underlying issues. As you age, your skin sensitivity changes. Thinner epidermis and slower nerve responses in the dermis make touch, temperature, or pain feel different. While diet, like healthy fats, may support skin health over time by reducing inflammation, evidence is mixed on its direct impact on sensitivity. Chronic stress and sunlight play bigger roles. Always discuss persistent symptoms with a dermatologist to rule out underlying issues. Prepare for your visit. List allergies, medications, and detailed questions about your symptoms, when they started, what worsens or improves them. This helps ensure you get the best care. This video is for education only. It's not medical advice. If you notice lasting changes in your skin, like numbness, pain, or temperature sensitivity, see a dermatologist. They'll help check for underlying conditions. Before your visit, jot down allergies, medications, including herbs and supplements, and details about when symptoms started, what makes them worse or better. This helps your doctor give you the best care. Always follow FDA guidelines for over-the-counter medicines, and talk to a healthcare provider if you're unsure. Remember, this is general health education, not personal medical advice. For individual